Hello, I'm Dr. Daksha Bakre, consultant obstetrician and gynecologist working at Cloudnine Hospital, Bellandur, Bangalore. Can scanty periods affect my chances of falling pregnant? Well, we have to address this question from three different aspects. Whether your scanty periods have become scanty recently, whether there is a sudden change in the pattern of your menstruation. Are these scanty periods associated with hormonal imbalances and period irregularity or any physical abnormalities? Or are these scanty periods scanty by default from the beginning? And whether they are really scanty to begin with. What do we really mean by scanty periods? So if you have been bleeding for less than 2 days, say only for 1.5 day, or if you have been bleeding for 2-3 days, but the flow is really low, where you need to change the ordinary Excel pad only maybe once through the day, then that could be considered as scanty periods. But if your periods have been regular, they come at regular intervals every 28 to 30 days, you experience bleeding for 2-3 days, but the bleeding is scanty in your opinion, it may not affect your fertility. That might be normal for you. But if you had a proper moderate flow prior to this and suddenly since a few months your periods have become scanty either in terms of quantity or the number of days, and they have also become irregular if they are coming too frequently, lesser than 21 days, or if they are coming infrequently, more than 35, 45, 60 day intervals, then that could mean that you are suffering from some sort of a hormonal imbalance. Hormonal imbalances can affect your chances of falling pregnant. So if there is a sudden change in the pattern of your menses, get in touch with your gynecologist. They will do the relevant tests and find out where the problem is. Once the problem is fixed, it should not affect your fertility. There are some other conditions which can cause scanty periods. For example, if you have encountered tuberculosis of the abdomen or history of lung tuberculosis in the past, if you have undergone any heavy medical treatments, radiation, chemotherapy, or if there are any structural abnormalities that have formed in the uterus because of previous surgeries like fibroid removal or curetting, and if that has led to scanty periods, then again it could affect your chances of falling pregnant or even chances of continuing the pregnancy once you fall pregnant. So if you feel that you have scanty menses, you must visit your gynecologist and get the issue clarified. We are here to help you. Do not hesitate to ask us any questions that you may have. All the best.